for the invitation, and I hope we can share the knowledge and experience and the journey that we went through at Sahha Virtual Hospital. I'll be taking you on a journey in Sahha Virtual Hospital and Innovation Enablement Center. So today, Sahha Virtual Hospital is linked to 170 hospitals where we enable digital transformation for those hospitals. Also, we help them in supporting them with the expertise and the consultant needed when there is a workforce gap. So especially in the rural and peripheral areas where we are connected with them and passing the knowledge and experience to those areas. I hope you can see my slides, if that's possible. Okay, perfect. I'll be sharing some key messages and some pictures and videos of the experience. This is an evolving journey, an evolving process where we learn and adopt with it. So there is a lot going on. So welcome to the future of healthcare. We're beyond boundaries today. I'm honored to take you on an exciting journey of innovation and limitless possibilities. My name is Dr. Mohammed Alhamali, and I'm thrilled to share with you the inspiring story of the world's largest virtual hospital, which represents a new era of medical excellence that we are proud to showcase the world. Next slide, please. So, as we know that our community faces significant healthcare challenges which can delay timely and appropriate care, especially after COVID. The burden on the healthcare providers and the nurses have been increasing. And how can we help with that? And how can we let innovation and digital solution enable and make their life easier and add value to that? Next slide. So we know that we know that the COVID and pandemic has acted as a catalyst, breaking down structural barriers that previously hindered health system investments in integrated virtual healthcare applications. I was reading recently an article, what happened in the 5 months at the start of COVID have impacted the digital transformation that's supposed to take in 5 years, which is amazing. So that's one of the pros of COVID, where it enabled digital transformation. Next slide, please. Next. So I'll zoom in to the Kingdom of Saudi Arabia and the Vision 2030, where we embarked on a huge transformation. Next slide. So we focus on 3 main pillars, which is an ambitious nation, thriving economy, and also where we enhance also the social responsibility. How can we enhance the longevity and vitality? How can we provide the best healthcare services to our community? And we focus on 3 things when it comes to healthcare: how to have a better access, enhance the quality, safeguard the patient, and reduce the risk hazards. Next. So when we talk about innovation, we know that we have to be aligned with the quadruple aim, which is how to reduce the cost, how to enhance the satisfaction of the patient, how to enhance as well the satisfaction of the healthcare provider, and reduce the cost. Next. So we've been building, and I enjoyed the previous session where they touched upon listening to the culture and listening to the people before designing and implementing strategic plans. So before going into implementation, we saw that in Saudi Arabia, a lot of people are using Twitter. And we started actually answering these inquiries and navigating a lot through Twitter. Also, we saw that the nation is a tech savvy. They're using a lot of applications. So we developed an application during the pandemic where they can link and book their appointments, and they can have also to have a teleconsultation. We learned a lot from it, and we evolved with it. And we started looking at KPIs to enhance the quality of service that are provided. We've reached to over than 35 subspecialties with over than 16 specialty. Next, please. So here are the numbers that we have covered in our digital blueprint and digital virtual care. We have covered over than 4 million appointments, total of patients around 1.7 million. Total facilities that are active with us is 1,500. And the virtual teleconsultation over than 6 million appointments. Next. So the Kingdom of Saudi Arabia have gone beyond transforming healthcare delivery and management by creating an exceptional patient experience through the use of cutting-edge technologies and innovation. So our commitment to providing a better patient care is reflected in our innovative approach, where we leverage the latest technologies in AI. And we will see some showcases. These are not futuristic, but these are real cases. Actually, today, this morning, our National Cardiac Committee, where expertise are joined in one virtual room, are discussing complicated cases around the kingdom, where usually these complicated cases takes 2 to 3 months just to have an appointment. And discussing these complicated cases also need top-notch or expert doctors to take a decision and to design the treatment plan and to follow up. Not only that, but also we have augmented reality where we guide unexpert surgeons. So those surgeons who are not confident in performing the surgeries in the rural area, we guide them through an augmented reality from the Committee of the National Cardiac Services. Next. So introducing Saha Virtual Hospital. Saha stands for in Arabic, health and well-being. So our specialized facility leveraged, as we mentioned, innovation. That's why started at Saha Virtual Hospital, but now it's Saha Virtual Hospital and Innovation Enablement Center. We designed the regulatory sandbox. As we know, innovation is always ahead of the regulation and the legislation. So how can we have a safe environment to test those products and test those solutions, especially that we are dealing with patients? Before introducing those solutions bedside, we will need to make sure that those really add value and they are safeguarding the patient. There is an impact also on reducing the cost. So today on the Ministry of Health portal, anyone from anywhere around the world can apply. If you have any solution that will add value to the ecosystem and healthcare, you can apply, and we support you to empower and transfer those ideas into product that really can make a value. Next. So this is a small video. Actually, this starting video is the National Cardiac, where they have an augmented reality and they guide those surgeons and the other hospitals. Can you play the video, please?
You don't need to shift the patient from a place where you don't have cardiac cath services. Yes. You can do a CT scan and you can access it here in our virtual hospital.
الله عبد المجيد.
ايش اخبارك؟
الحمد لله.
تخيل 7 سنوات وهو يعاني من المرض ثم يتحسن في الأمس.
حسب كلام الأطباء أني تعديت مرحلة الخطر.
الاستشاري وتم الدخول على منصة الطب الافتراضي والتواصل مع الاستشاري وأخذ الفحص كامل والتاريخ المرضي للمريضة. تم الاطلاع على أشعة المريضة عن بعد وتحليل الأشعة ورؤية أن المريضة في حالة سكتة دماغية حادة تستدعي تدخل، وتم اتخاذ القرار بإعطاء المريضة العلاج اللازم. كان الوقت اللي تم إعطاء العلاج فيها كان وقت قصير، وصلنا ولله الحمد إلى معدل 25 دقيقة من دخول المريض حتى أخذ العلاج المناسب.
الحمد لله. الحمد لله.
So we're proud to announce that Saha Virtual Hospital have served over than 85,000 beneficiaries across than 170 hospitals with an annual capacity exceeding 480,000. Our facility have trained over than 30,000 healthcare professionals, and it's the first virtual hospital in the world to receive the accreditation with the highest degree, which is a diamond, and we are passing the knowledge of how we started this journey. We have a partnership with the WHO where we share our knowledge and all the guidelines and the process with developing countries to benefit from our journey. So also we owe our success to the hard work of our dedicated team of healthcare professionals who run 6 specialties and 49 subspecialties that are the true heroes that have gone on and beyond to provide high quality care using cutting edge technologies and innovative approaches. We'll also have a close and a deep dive into each of the specialties that we provide. Next slide, please. So for the telestroke, which is one of the specialties in the department, so the objectives was to revolve around treating all patients near their homes, providing them increased access to care, reducing relative mobilization and CO2 emissions. The impact was a 30% improvement in access, a reduction of door-to-needle time from 105 to 33 minutes, and a timely treatment with a response time of 1.2 minutes, leading to a major cost reduction and increase in patient satisfaction. Today, our team is involved also in Mecca, where they're seeing over than 3 million pilgrims are coming. Our IoT and remote monitor devices help those doctors who are navigating across the kingdom to make an informative decision based on those vital signs that they can see. They can act fastly and respond to those urgent cases and activate a stroke code. Next. So for the radiology department, the aim was to improve access to high quality services, increasing the confidence and the quality of care provided in both rural areas and hospitals, and enhance patient experience and satisfaction. The impact of the effort was to reduce the waiting time, reporting from... Sure. So reporting time, it was from 15 days to 5 hours for the OPD patient, 21 increase in the scans volume and low utilized modalities, reduced patient transfer to obtain high quality services, direct and indirect positive impact in the radiology department KPIs. Today we're using actually a tele-acquisition where we control the cabinet of those CT scans and imaging from the central hub, which is in the capital city, where we also pass the knowledge and transfer for those technicians who are less expert, where they can really know how to take the right imaging for those patients. Next slide. So for the ICU department, the aim was to improve the quality of care and intensive care quality unit, provide an efficient bed management and intensive critical care unit, and transfer the knowledge. The impact was 100% compliance to admission and discharge criteria, decrease the length of hospital stay by 23%, decrease the ventilators associated with the pneumonia by 35%. Next. So at Saha Virtual Hospital, we take a comprehensive approach to activating our teleservices. Our teams goes through several steps to ensure that each case receives the best care model suitable for their needs, while prioritizing patient safety and satisfaction. So our process include understanding each case unique requirement, governing healthcare service to guarantee the patient safety, ensuring clinical and technical team readiness, and finally signing a service level agreement. So by following these steps meticulously, we deliver a high quality telehealth solution that meets the highest standards of care. Next. So we'll go to the telecardiac services where we provided a cross-border. So now we're doing with Egypt a teleconsultation and also Mauritania. So this is a glimpse of some of the devices that we're using for the remote monitor of heart failure patient. where we are reducing the length of stay, and also we're using the latest technology. And also we're in a process, since we have the sandbox, where we are part of the clinical trials to try the robotic surgeries. Next. So also we participated in supporting those who are affected by the earthquake. Our IoT devices have been on the ground, where our doctors in the kingdom are supervising and also helping those in need, where they can make an informative decision. Always the gap is, how can I make an informative decision with little bit of information? And this really helped the doctors, where they can make and act on those information. Next. So the medical specialties that were covered during the crisis, from cardiology to pediatric to ophthalmology to internal medicine, infectious disease, OB/GYN, and orthopedic and dermatology. And this is actually a collaborative effort with the stakeholders that are involved, where this is a joint effort to really provide the value and provide quality services. Next. So here are some of the examples where the team actually working in expanding our services to other countries, from telecardiology, as we mentioned, to tele-ICU and tele-stroke, and also learning from other countries and how are they dealing with their patients, and how are we evolving as well with the new technologies that are being advanced on a rapid pace. Thank you so much. That was my last slide. I hope that our journey was really fruitful, and that this journey really happened with our heroes, where it was really a struggle. It started with a visionary board that we have, and how can telemedicine help in the COVID. During the pandemic, everyone were at their houses and not really getting an access to care. So we really evolved with those. And if you see those specialties that have been selected, actually those been selected because they're a burden either on the cost, or there is a limitation of number of workforce, as we know that there is a big workforce gap, and how can we let technology really help us in that. So thank you so much once again. I'm happy to take any questions and answer them and share our experience as well. Go ahead.
Hello, Roelie, Netherlands Red Cross. Thank you. Extremely impressive, what you've done. My question is, can you tell us a little bit about the challenges you've encountered to get this done? Because I'm sure there were plenty, and how you went across solving them. But again, extremely impressive. Yeah.
Thank you so much. There was a lot of challenges. If there was no challenges in a single day, we would really panic, because if there is no challenges, that means we're not doing our work right. So the first, when we had the Department of Innovation, we had to really be linked to decision makers so we can enforce. As you know, healthcare providers, when you want to nudge them or change the process of how they deliver care, is really a challenging. So educating them and letting them know about the value of these changes, it is really important. So this is one of the first steps that we realized before in providing any service. Let's sit down with our healthcare provider and team and really listen to them and listen on the conventional way of their doing care. After that, introducing, where we do a benchmark and we introduce them to those technology that can make a difference, the value of data. So those healthcare providers now are getting to know the value of data. We have a big screen at the hospital where we see the numbers and the impact. So now that they know that the data is really important, And when we ask them and we try to learn more, it's not to question how to deliver. It's not that we are trying to audit the way that you do and your numbers or surgeries. No, it's how can we evolve? So we have a safe dialogue where they can share their experience, and if there is any mistakes, we learn from it, so we don't have trend of challenges. One of the things is that we are enabling entrepreneurs and innovators and researchers, especially researchers. Unfortunate, with researchers, the outcome or the goal is to publish at a high impact journal. But what about research translation? Taking that outcome into real products that can benefit patients. We can see a lot of articles that are being published. So what is the outcome? What are those products? Okay, we've seen from the literature review, we've seen your study, amazing study, but where is it on the ground? This is one of the things that we really enabled them. And we saw that innovators and researchers are always afraid about their ideas. So from day one, we secure their intellectual property and tell them, we are here to help you through this journey. So going through these pilots, we design pilots before launching those products into a real environment. So those product goes to a 6 months proof of concept. We select a small village, we do a governing for those services, activation for day one, ensuring the patient, ensuring all the elements, the doctors are trained, the healthcare provider, the patients are known, also getting to know that they are part of a study and this is a new innovation, we get their consent and start. After doing the proof of concept and seeing the success of it, we nationalize it and also we do a cross-border with those services. I hope I answered your question.
Yes, thank you.
Thank you. My name is Marwa from the Canadian Red Cross. This is innovative and highly impressive, so thank you for such a good presentation. Off the top of my head, I'll just give you a little bit of a context before I ask my question. I'm thinking about emergency response units within Canada. It's very international, but we are moving it domestically. We have multiple remote and rural communities that are only fly-in communities within northern Canada. And I can totally see this as a potential solution, but one of the roadblocks I'm thinking about is internet connectivity. So I was just wondering, you mentioned remote communities within Saudi, and I was wondering how you overcame that hurdle, because this is very tech intensive, high tech is required, and I was just wondering how you took this very innovative approach to places where there's very low technical capacity or savviness. Thank you so much.
Thank you for your question. So our team is trained. It's between healthcare providers and tech team, where we cross together, and before activating any service, there is a readiness check. We have with our technical team a satellite. So we use satellites to reach connectivity. So for example, with the crisis, it takes our team only 2 days to do the full setup and be at the area and start working and accepting the first patient. So this is now our 3rd year in Al-Hajj in Mecca, where over than 3.5 million pilgrims that they come. Our team is having their own secure connection with our team in Sahha Virtual Hospital. Also, would love to, if there is any possible partnership where we can help and also exchange knowledge and experience from other countries, we would love to do that. Sahha Virtual Hospital and the Ministry of Health and the Red Crescent, we proactively go to neighboring and other countries where we can connect and really can benefit from the expertise, and also now what we've done with the evolving process, we saw that, for example, the oncology, we have an oncology board, and really it's a multidisciplinary team where a lot of healthcare providers sit on one table, and there is a fruitful discussion where we try to capture it, and we let residents and students that they join those sessions and learn from it as well. So as Sahha Virtual Hospital, we're open to any collaboration that really brings a positive and a social impact. Any question?
Yeah, right here. So it's a wonderful innovation in your country. So something just popped up in my mind. It's something visual, virtual, and I thought of the PWDs, people with disabilities, especially the hearing impaired and the visual impaired. How do you communicate to them?
That is a beautiful question. So I've mentioned from the beginning and during the presentation, it's an evolving process. And this is our loved one with the disabilities. We've enabled new solutions. So now for the virtual care, we actually have a doctor and a sign language and the patient, where the sign language becomes the linkage between the patient and the doctor. So this is how the business continuous plan for these services evolve.
Thank you very much for your brilliant presentation. I'm very impressed with it. So my name is Soshino from the Japanese Red Cross. I'm very so in 2001, I was deployed to India for the Gujarat earthquake relief operation. At that time, we sent a few pictures to our hospital to consult our doctors. But now I can feel the progress of human beings. Thank you very much. So I have two questions. At first, in the very beginning of this project, the stakeholders in your countries are relatively positive for accepting these innovative changes. Because I can imagine there are a lot of challenges. So actually in Japan, we still have challenges
Same thing,
introducing this telemedicine system.
So let me go and answer your first question. Change is really difficult, especially in a complex system like healthcare. For those, for our healthcare providers to change the process and how they practice is very difficult. And bringing new innovations is also, it's quite challenging, not one size fits all. You can see an innovative solution like in Canada or in Japan, but when you bring it to Saudi Arabia, it doesn't work. So you have to understand the culture and the behavior of the people who will be used the technology. So when we talk about innovation, it's either technology, process, and people. Nowadays, there is a lot of technology. You can have the best technology, but people are not adopting it. So it's really quite a challenge to change. It's a change management and a nudging where it's a long-term process. But when they see the value and the impact, everyone will come and help you to progress. So that's why in being an entrepreneur, it's always good to design your first MVP, which is the minimum valuable product. Show the impact of it, and then later on, people will join you and helping you, and how can you have a business continuous, and how can you scale it and evolve it?
Thank you very much. And one more question. So in 2015, we, Japanese Red Cross, jointly proposed with the Tanzanian Research Institute about the telemedicine system to make a diagnosis in rural areas of Tanzania. And our proposal, we proceeded to the finalists of the Gates Foundation's selection. At that time, do you have any plan to apply this system for the education for the young health staff in rural areas or people in the community?
Yes. As I mentioned, we have a partnership with the WHO where all the guidelines and all the lessons learned from the journey that started in 2019 till today, and there is a lot of publication that we worked on. It will be shared for developing countries, and how can they use the resources that they have with limited resources? Always, it's a big challenge. So how can I use what do I have and what is most important? How can I prioritize? So all of that will be shared with a partnership with the WHO. It will be published really soon.
Thank you very much. Chaim from Magen David Adom in Israel. Thank you for a brilliant presentation. Very interesting project. My question is with the link to the emergency care, to the pre-hospital care. Have you piloted that? We know in our business in EMS that 30% of the patients that we see don't really need to go to a hospital. And if we had this opportunity of consulting with an online physician, we could maybe provide them better care at home and avoid the overload on the overall system.
Amazing question. So now one of our goals is to reduce going to hospitals and clinic, because one of the things that we noticed that the primary care is really being neglected in Saudi Arabia. So always they're going to the tertiary hospital, going to the emergency, either for a simple illness or a complicated illness, which can increase the crowdiness, and it really doesn't help the system. So one of the things is that we're trying to reduce by 50% where they use teleconsultation. Now we're doing a survey on those patients when they use teleconsultation. Did they benefit and did they need to go to the hospital? Only 5% they needed to go to the hospital to see and feel the doctor examining them and giving them their treatment plan. So it was a really an eye-opener for us, where we need to do more education and health literacy about teleconsultation, that you don't need to go to the hospital. You can get your consultation at your comfort of your place through teleconsultation. I'm happy to connect with everybody. We'll be here the 3 days, so we're happy to connect and share our thoughts and any potential partnership as well. Thank you so much.